For decades, it was believed hormone replacement therapy, also known as HRT, came with an increased risk of breast cancer or for for perimenopausal and menopausal women. And that link was disproven years ago, but warning labels on the therapy remains.
That is until now. KPRC2 anchor Lisa Hernandez is in the newsroom with the new development from the FDA and what it means for women's health. Lisa?
Yeah, Joel and Danny, doctors who specialize in menopause care are cheering this decision tonight. The warning labels that have been there for years represent outdated science, and the hope is that getting rid of them will help reinforce the latest data, which proves the benefits of HRT outweigh a patient's risk.
Dr. Terry Ann Samuels, a Bel Air-based board-certified urogynecologist and female pelvic medicine and reconstructive surgeon, is beaming over the news that warning labels on HRT will be a thing of the past. The warnings were in response to a 2002 clinical trial that was stopped after it detected an increased risk of breast cancer, heart attack, and stroke in women on HRT. Studies done more recently have not found the same increased risk, and the FDA said this week that it would stop the, quote, fear machine steering women away from this life-changing, even life-saving treatment.
So there are two aspects of it. There's the preventative aspect in terms of the prevention of certain conditions. And then there's the actual aspect of conditions or the condition of being without estrogen. And those manifest in things like vaginal dryness, hot flashes, night sweats, brain fog, insomnia, mood swings.
Many women have never even been taught what to expect from perimenopause or menopause. Their providers may not be up to speed on HRT options or the latest menopause research, only adding to the confusion.
How do you talk about something that no one ever spoke about? How do you deal with your body feeling like your body's failing you? And then, you can't look up to your mom because she doesn't know. She didn't have the option either. So for a multitude of reasons, we were not discussing it. And now we're clear. Things like when you're talking about not feeling well leading up to those years and up to 51, we're now clear that there's a gradual portion of it that can be up to 8 to 10 years before you stop having your period.
And just as important as talking to your doctor about the best treatment options, Dr. Samuel says it's vital to find a provider who listens. If you feel your symptoms are not being taken seriously, it's time for a second opinion. Live in the newsroom, Lisa Hernandez, KPRC 2 News.